Okay.
Hello and welcome back to the Healthy Reboot. It's Susan Johnson, and I am so excited today to be interviewing Leslie King. Leslie, I met through, I spoke at a kind of holistic health conference, and she was the thermographer there. And I have to tell you that for years I've been wanting thermography done. When I lived in Rhode Island, it was kind of one of these things that you had to kind of back room and they brought the thing in. And I know that's probably changed by now, but I always wanted to have it done because I really feel that for many people, it's an excellent option for early detection of things. So when I met her, I said, I need to come see you. And I actually went last week and had my first thermography done. So I want to introduce Leslie. I want to talk a little bit about why she got into this. And then, believe it or not, I have my results back and I'd love to show them to you because I think you'll find them as fascinating as I did. So let me introduce Leslie King. So Leslie has been 27 years in the healthcare industry, and I have to remember how to pronounce this right, 24 years as a prosthetist and an orthotist, and she can explain what that is. She transitioned a couple of years over to a more holistic approach. I want her to tell her story about that and actually got into thermography. And I have to tell you, I was really impressed by, the process, the machinery, the photography. And so, Leslie, welcome, welcome, welcome. And just tell us your story, because your story was really interesting to me. And I think many of us that get into this have a similar story.
Yeah, so thanks for inviting me. I'm excited about this. So for about 26, 27 years, I worked in healthcare as a prosthetist, orthotist, not what you're thinking, um, but making prosthetic legs and arms and feet and created different type of braces that we built for ourselves so people can walk and move again. Loved my job. There's nothing better than putting a new prosthetic leg on somebody. However, the company sold out. And when that happened, the company went nuts. As far as the much of time I had to work, I was exhausted and I just knew I couldn't keep doing this. So I started looking into something else that I could do. Also, before I mention that, I also loved to volunteer. I'm all about volunteering. So I opened up a little nonprofit called Catalyst Sports. Knoxville was mine as a volunteer and worked for 11 years and getting people with disabilities in South, like going Cadillacing. Some people are going to get out on a mountain bike. Some people are just going to go climb, but we teach them how to do it and we have support. So there's more than just thermography and more than just, being a prosthetist orthotist. It's helping people with disabilities.
Well,
So that
you're
was
right up
fun.
my alley when we talk about that. We're all about volunteering, and I own my own nonprofit as well with my family. So we love that. That's great. All right, keep
Yeah.
going.
Oh, yeah. Okay. So after that, I started looking into something else to do, stumbled across thermography and fell in love with it. And the reasons I love it the most is just because it's so easy to do. There's no radiation contact, those types of things. And we're giving tips of what's creating in the body before it becomes a diagnosis.
It's me. I put my thing on hold. I have for everybody out there knows that I have a tower garden in my office. So I have beautiful greens growing in my office all the time. Ready?
Oh, yeah.
But they play. They run water every so often. So I try to turn down my water. So it's really interesting because everybody knows I'm super holistic. I really prefer not to have anything invasive done, and we know the importance of breast self-examination. We know the importance of staying on our health. We know that the body can show many signs, but tell us why thermography is different from mammography and how it can kind of catch things before. And if you want to kind of talk about what thermography is in there, you kind of giving you a whole mouthful, but it kind of all ties together.
Yeah, so the differences in a mammogram and a thermogram is very different. So with thermography, we're mapping the heat created by the nervous system. And so the doctors that do these readings are either an MD or DO. After that, they study thermography, they do the readings. And so they're looking for increased blood flow, which would be feeding cancers, where they're looking for increased inflammation and asymmetries in the body that should be the same but are not. They're looking for those types of things to see what's creating in the body. With your mammogram, they need structure. So they're looking for a tumor or a cyst or something that's structure. And it takes time for that to grow to be a diagnosis. So we're looking for indicators.
Yeah, so basically thermography can see these hot spots or these areas of interest before they actually form into something that we could potentially feel or they would diagnose as something worse, right? Something like cancer.
Yes.
Yeah, and what I found fascinating about this was because again, I had opted with Leslie to do the entire body because I'm like, okay, no, I'm in. I want to see what this is all about. But I was surprised at what else they looked at. I've often only thought of thermography, not that I didn't know that they did it, but most people kind of concentrate on the breast because breast cancer is obviously a great concern for women. But it really looks at many different things.
Oh, yeah. It's just completely different. And these doctors are giving you tips of what's growing in your body, so you want to take that information to your health provider. And, hopefully they will know what to do. Like, let's do some detoxing, those types of things, give it a try. And so that's very beneficial that instead of just going to your annual appointment, and the next thing you know, you have a diagnosis, but there's been no symptoms, there's been nothing mentioned about it. And all of a sudden you're terrified.
Yeah, absolutely. Super terrified. And so I know a question that'll come up is that thermography, can it also detect structure? Or do they see a spot and they say it's time for you to go to do something different?
Now they don't see any structure because we're just
Okay.
mapping heat.
Okay. All right.
So they're
Interesting.
looking for all of the warmest and coolest areas will be in your body as they should be. But some things that should be warmer that are cooler, that's an indicator. And
Okay.
that's how they know to go to find what to look for.
Oh, interesting. That's fascinating. I have to tell you, so when I get to Leslie's office, she's got a camera that sits on these two runners, right? And it's this really cool camera that detects the heat. And she enters your information. You've answered a lot of questions beforehand, so that they can actually look at what maybe your symptoms are or your history, and then they can look at these particular hotspots, and you can see as she's taking the pictures what's going on. Now, obviously, you can't read them, but it's really cool to see your body in heat and in different ways. And they take them again. It's not invasive. There's no radiation, which is just amazing. It's such a great way to do it. And you're in different positions, and she works with you to they did everything from my hands to my neck and my back and my stomach as well as my breast. So it was really fascinating to kind of see that, you know.
Oh, yes.
Yeah. Anything else you want to do? We'll go through my results because I think that's really interesting. But is there anything else you want to talk about the cameras or anything about, those type of things, or maybe how long it took you to become a thermographer?
Yes, it took me a long time. There was a lot of training. The camera that I have is an FDA infrared, FDA approved heat seeking camera. So it's not your standard camera. And then what we can do with that, because it's thermal, we take thermal imaging. And that all shows all the hot spots too and cool spots when you get your thermogram back to you. So it's just, again, it's just something, I think that something in this area we live in is kind of forgot about thermography for the body, because it can be used for several different things. But now we're showing up that yes, we can see your body and where it's happening.
I love that. I mean, I love that. And again, in today's world, there's so much going on. And our body often tells us things, but we're not listening. By getting in and doing something like a thermography, you can get a good picture of your body. Now, they want me to go back in 3 months. They did find a little irregularity in one side was asymmetrical to the other one. So like, listen, this is something, again, doesn't mean anything bad, but it means, hey, listen, we want to go see. Is it changed? Is it still the same? Is that just something weird about your body? But you get this great baseline, and then you can work through this through the years because they'll have a baseline of what you've got going. So again, just like we talk all the time in my programs about Alzheimer's and dementia, and how really it appears years before it ever manifests into a disease. This is the same kind of thing when you talk about thermography. You can see things going on in the body that you can address now and reverse them.
Yes, you can. Now, that first time that you ever do your thermogram, they're going to always ask for that follow-up you mentioned in 3 months. And at that point, each breast will have its own baseline, and that's what they're looking for. But then after that, if you want to continue follow thermography, it would be an annual appointment, just like your regular doctor. And
Great.
in between the time, if you have any concerns, you can always schedule one on your own.
Nice.
So it's just something that you can definitely help manage yourself for your body.
Yeah, yeah. Again, it's just such great information. And so one of the things that, and again, I'm totally transparent with the people that I work with. I mean, there's no secrets in my life when it comes to this kind of stuff. One of the things I've been dealing with has been some inflammation in my hands. And I am super clean, organic. I mean, I take the turmeric, blah, 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 blah. But I really wanted to see that. So it was really interesting to get back the results, as you'll see when we look at my things, that they did recognize that I have a little arthritis going on, and that, that maybe some Raynaud's, maybe I've got some circulatory issues. And those of you who know me know that, we're big Beamer users here, which is the PEMF mats. It means I need to spend more time there with my PEMF mat so that I can increase that circulation. I don't often spend the time with my hands, although I'm on the mat. I don't often take the time to wrap them in my hands. I'll have to do that. So really cool. So let's go through my results real quick. We can have a little more conversation. And then I'd
Yeah.
love for you to tell people at the end of this, how do they find a thermographer? What do they look for? And those kind of things. So kind of keep that in the back of your mind as we're kind of looking at my results. So let me just see where I can find my results here. Open file. I must have already opened this maybe. Let's do it again. I thought I was good and open this beforehand, but there it is. Okay, so let's close that down. And here we go. I'm going to share my screen. Share screen 2. There it is. So Leslie, can you see my screen?
Oh, yes, I can.
Okay, so this is the report that I got back. So Leslie said to me, hey, listen, it's going to be a couple of days. It depends on how busy they are. You'll get some information from me. She texted me and said, hey, we've sent you an email. She made sure I could open it up and that I could read what was going on. Now you can see here that, they asked me, this is what I told Leslie, I've got, what I had, conditions, some of my dental stuff, again, all the things that have been going on, the different things. And then here comes the interpretation. So I love this. So let me see if I can't make this a little bigger for everybody. Let's see. So there we go. That's probably a little bit better. So it said, so first it did my head and neck. So it said, hypothermia at the earlobe should be correlated with inflammation and infection. Hypothermia at the region of the ethmoidal sinuses should be correlated with sinus congestion at that level. This thermal finding may be related with subclinical inflammatory changes of the sinus mucosa, an indication of systematic inflammation. So basically what they're saying is there's something going on in my nose, correct?
Yes.
Yeah, and I have right now, you can hear it in my voice a little craggy, there's got to be some kind of a seasonal thing going on or whatever. That doesn't surprise me. Now, what I loved about this, so you can see that the dental and periodontal, she said there's some upper jaw, either side of the mouth, which should be clinically correlated with dental dysfunction or periodontal inflammation, which seems to have lymph drainage towards the submental lymph nodes. I found this really interesting because I am struggling a little. So now I know I can go in and there's a lot of all natural things I can do to support my oral health. I'm really very good, but there are more things that I can do. Everybody knows I'm a big user of essential oils. There's a lot of like mouthwashes that I can do. Living makes one, but there are essential oil blends that you can put together that can really be very helpful, as well as, certain things that you can put on on that area. So I thought that was interesting. So the temporomandible joints, the TMJ, I had nothing, which was great. The thyroid gland. So this was really interesting to me. There were no significant thermal findings in this region. One of my biggest challenges in life has been Graves' disease. And years ago, I mean, this goes back probably 14 years, I did have a goiter. I did have, there were things going on, but I worked really hard to keep my thyroid in check, happy. So I was glad to see there was no inflammation, right? Again, this is inflammation we're talking about, so hot spots, but there were no hot spots there, which made me feel good because I personally know when my thyroid's out of balance because I can feel it. I've done this for enough years to understand when I run a little hot or I run a little cold or something's not right. But I was very happy to see that there was no significant thermal there. Do you want to say anything about any of the things we've talked about?
Honestly, you're doing a great job because a lot of it is a lot of language I don't always understand myself. So that's why I'm glad we have other doctors that can read through to it or health providers. Another wonderful thing about thermography is, let's say let's say that you have some concerns about what's in the thermography and you don't really understand what to do. We can provide a health provider to the doctor who did the reading, which that doctor's name is on your thermogram, and it's free. It's just education.
Nice.
So that can, educate other doctors so they understand thermography for other people that start doing it. And I think that's another really good piece about thermography.
I
But
love
doing
that.
the readings would be very difficult.
Oh, yeah, absolutely. And then again, I love the fact that you've been through a lot of training, so you know what you're doing. The docs, our docs, DOs or MDs, they've been through mammography training, and then they can talk to your doctor. If anybody knows, sometimes you go to your doc and they look at the stuff and they go, oh, I don't know. What do you want me to do with it? Well, now there's a resource for you, and you get this report yourself. It's not something you have to go find. So you can also look into it. Listen, education is the key to good health, right? Understanding and trying to wade through some of this stuff, as well as working with your docs. Now, I love this. The carotid arteries, no significant thermal findings. I love that. The neck, hypothermia at the posterior and lateral muscles of the neck correlates with myofascial inflammation. So again, this is that dental stuff that kind of goes down the back. So that was really interesting to me, because again, I do have some tension, some stress. I do work out a lot, but understanding that there's some stuff going on here really helps me maybe understand what's here, and I can try to go and correlate that, which is really fun. So here was the interesting thing for me, the breast. So it said, there is hyperthermic asymmetry in the right breast where a vascular pattern with foci of hypothermia can be seen at the upper quadrants, which should be monitored for change. The foci of hypothermia in the upper outer quadrants of both breasts do not appear suspicious, but should be monitored for change. There are no specific thermal findings to correlate with neovascularity in either breast, meaning something that they would worry about. This study is suitable to be archived and compared with a repeat study in 3 months to establish a baseline prior to annual testing. So basically what they're saying, listen, we see something, it's not something that we think you have to go rush to your doctor for, but hey, we want to take a look at it. We're going to do that 3-month visit, and then every year we want to look at it. And common sense would tell you, okay, there's something going on. I want to make sure I'm doing I'm doing my breast exams, right? Making sure that I'm keeping up with that, and looking at my lifestyle to make sure that I'm doing the optimal things for best health. Am I eating the right foods? Am I managing my stress? Am I getting the right sleep, right? I mean, am I in motion? Are my lymph draining? I mean, there's so many things. It's such a holistic approach is what we take here. So anything you want to say about that?
I'm following you right now.
Okay,
I don't
great.
really, like I said, I don't really have the education to talk about what you should do other than talk to your health provider.
Yep.
So I
And I
think you're
love
doing a
that.
great job.
Yeah, no, I love that. And again, we always say, listen, we love holistic. We love anything we can do all naturally, but there's a reason for allopathic medicine. There's times when you need to do something medically to make sure that you're around to follow up with all that holistic stuff, right? And anything like this that we can catch beforehand is going to be key. So this next one was interesting to me. So this is lymphatics. Bilateral hypothermia at the region of the lateral axillary lymph nodes should be correlated with lymph congestion at the level. Lymph drainage therapy should be helpful if there's any tenderness in that region. So this says to me, my lymphatics are a little slow and sluggish. And then remember, your lymph is how your body drains and how it moves through things like your white blood cells. But unlike your heart, which pumps blood, your lymphatics don't. They have no pump. So unless you are pumping them, they don't necessarily move. So how do we do that? Remember the old rebounders you held on and you jumped on that little trampoline? That was a rebounder that could get your drainage going. You can do a lymphatic twist where you can move. You could jump up and down. You can do exercise. And I'm a good exerciser, but we have really been we haven't been as regular as we normally have. And so I did go see one of the DOs I met at that same conference, and she does some corrections in that can help with lymph drainage. So I'm going to go and do that. I'd gotten this and I said, listen, this is an area that I want to make sure my lymph is moving. This is how the body, again, moves through the white blood cells, moves through the toxicity, super important. So I thought that was interesting.
So I've got something about that,
Yeah.
the lymphatic system. Probably 6 or 7 months ago, I started having random shooting pain on the left breast. And so I'm like, okay, it's time for me to get my thermogram. and it pulled back up as the lymphatic system. And they said, do some brushing. And
Oh,
in
I
like
love
two
it.
days,
Dry
it was
brushing.
gone.
Yeah.
Yeah. And in 2 days, it was gone and it hasn't happened again.
I love that. I always forget about dry brushing. Yeah, dry brushing is a great way. So you can
Yeah.
get your, and again, something you can look up at YouTube. I'm sure there's YouTubes on it that you can go if you don't know what it is. That will certainly help you do that. And, for those of you who are just looking for good health, or you're just kind of listening to this and think this is fascinating, you can dry brush anytime, right? You don't have to have been, told that maybe you have a little congestion before you do that, which is interesting. Now, I love this next one, had no idea. Hormonal systematic patterns. There are no thermal patterns to correlate with a hormonal imbalance or estrogen dominance. This is big, right? The fact that they could potentially pick up signals that say, you need to look at this, because we know that in today's world, with all of the plastics, the household cleaners, the beauty care products that, and then some of the, the antibiotics and these things that, the hormones that they're putting into things, it's very easy for people to get out of balance with their progesterone, estrogen, their testosterone, estrogen type of levels. So the fact that they could kind of correlate something here was really interesting to me. I think, again, when you get into estrogen dominance, so when the progesterone levels go down and the estrogen dominance goes up, and it's exasperated by the beauty care products that have estrogen-like substance in them and those type of things, this is when you can fall into challenges with your uterine, right? Fibroids, cysts, cancers, right? So we want to try to keep that balance down. And again, the fact that this could read something that says, hey, you might want to take a look at this, I think is really great. Okay, so upper and lower back. There's hypothermia at the upper back, which correlates with the myofascial inflammation in the region at the right rhomboid and levator scapulae muscles. So when I went into Leslie, I said, one of the things I'm facing is in my right arm, I've definitely got something going on. Again, I'm a big we do a lot of workout, we do a lot of weights, but this one's been really kind of bothering me. So again, it said, all right, there you go. You've definitely got something going on. She says there is also spinal hypothermia at the thoracic and lumbar levels. Remember, this is in your spine, which should be clinically correlated with joint dysfunction at that level. So chiropractor, osteopath, go to someone and make sure that my joints and my body are all in a line. And that could potentially help this, right? But it can also just help realign my body.
Yes.
It says joint-related activity in the spine is a common finding. This indicates a degree of inflammation, but it's not by itself diagnostic or suggestive. Again, it's not saying it's anything bad, but listen, good posture, you having, all your spinal alignment intact helps with the body flow as well. So that's great. So neurological, there's no thermal indication of lumbar, and this one, radiculopathy, whatever that is. That one's beyond my pay grade. So, autonomic and immune system. I love this. No significant thermal findings. So many people struggle with the fact that their sympathetic nervous system is in fight or flight all the time, and that they're struggling between their sympathetic and their parasympathetic, and their immune systems are out of whack. If there's something that can help you figure that out, that's huge, 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 huge. I love that. All right. So another interesting thing. So abdomen, visceral. There is also hypothermia at the region of the transverse colon, which should be clinically correlated with inflammation of the colon at that level. There are no thermal findings to correlate with visceral inflammation or any other thing. So again, they're saying to you, listen, there's something probably going on in that transverse colon. Remember, the one that goes up and around. We all know, you guys have been with me a long time. I have digestive issues. I have for years. They're in the best place they've ever been, but I do know there's still places where I need to work. How great to know that there's a little something going on in that transverse colon. Some of the things I can do would be to work with leaky gut. I could work with bone broths. Again, I could relook at what I'm eating and those kind of things. So there's a lot of things that I could actually look at there. Let's see. Genitourinary and reproductive. Diffuse hypothermia at the pelvic region should be correlated with dysfunction of the uterus, ovaries, or urinary bladder. No other significant findings. So again, there's a little heat down there. Something to look at, something to watch. Again, something to think about. Yeah, I have to see what that is. I want to look at that a little deeper. I don't generally have issues in that area, so we'll see. This one was interesting. Upper extremities, hypothermia at the region of the anterior shoulder correlates with the reported inflammation, right? There is hypothermia at the CMC joints of both hands. That's these guys in here, which correlates with reported inflammation in the hands and arthritic changes. Glove-like hypothermia at both hands should be correlated with peripheral vascular insufficiency. So my microcirculation down in my fingers is bad. Now, when I was younger, I was a skier. I worked in ski country and I hated gloves. So I often would not wear my gloves, or I didn't have the best of gloves. And I often had very cold fingers that would turn white. This could be a reason for that. It could be something else, but I've had it my whole life. But again, having someone say to me, hey, you've got that, means that on my beamer, I need to spend some time. You know, there's certain essential oils you can use and those kind of things to see if I can't improve that microcirculation. Raynaud's phenomenon cannot be ruled out. Raynaud's are when your hands turn white. My husband has Raynaud's, but again, that's a microcirculation issue. Lower extremities, no, vascular, no significant findings. So the thermal findings in the right breast are classified at some risk for development of significant pathology pending establishment of a baseline. So again, you need to go back. We need to look at it. It could be nothing. It could be something. We want to make sure. Obviously, any lumps or changes should be clinically evaluated without delay, regardless of thermographic findings. Breast thermography should not replace conventional imaging. But what I would say to you is that you need to talk to your doctor about when and how many times. When I left my doctor, last time I had my particular appointment, she had moved me to every 5 years. She had said, listen, we are understanding that maybe radiation isn't the best and you have no issues. We're going to move you to every 5 years with the understanding that you will do self-breast examinations, that you will take time. So this is an option. And again, this would be a way for you to do some preventative things now so that when your doc says to you, hey, you don't need to do this, or you make that decision personally, only you can make that decision that you've got these things going on. So suggest clinical correlation thermal findings, blah, 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 blah. So left breast at right breast, some risk, and then there's some guidelines. So they give you this stuff. And again, I will set an appointment for go back in 3 months. I think that's really important. Let me stop my screen share here. So I think again, I love that. I think it's really fascinating. I'm very pleased with my results. Again, I'll be 63 in May. So, to have all those things going on, and I've not been the healthiest. I do have Graves' disease. I did do some kind of bad things to myself years ago with my diet and McDonald's and Suzy Q's and tabs and those kind of things. And so nothing surprised me. I was really pleased. And again, I found the experience really a positive experience. So thoughts on all that?
Yeah, so many people after having done their first thermogram are thrilled. They're sick and tired of the radiation. They're tired of the same medications every time, and they're worrying about what's happening. And it's just so easy. It's just an easy process for you to do. And we have wonderful doctors that support it. And the results are remarkable when you see like something like you have now with the breast, like you need to be working on one side to get some of that out of there. And then after 3 more months, if you continue to follow to create like detoxing, etc., it comes back to normal.
That's right.
So many times. And that's what you want to know is what's creeping inside the body. And with thermography, it's just a great way to know.
Yeah, and it's something you can't see on the outside. They can see from the inside. And again, it's that holistic approach to working with your body. We have so many factors coming at us all the time. We don't need to be adding the additional stress of things like radiation if we don't need to. And thermography is an investment. There's no question. It's an investment, but it's an investment in yourself. And I always quote the famous saying, if you don't take time and investment for your wellness, you'll be forced to take time for your illness, which will mean you're not making any money. So take the time to invest and look at these things. And again, you can see all the cool things that they saw, right? It wasn't just my breast, it was my hands, my fingers. And we had a little challenge with my feet. So that's okay, not a big deal. But again, I don't have any, but again, they usually do the feet as well. So not a big problem there. So again, this is a great way to get an overall look at your body and figure out where you are. And your body wants to be in balance. It doesn't want to be out of balance. And if you give it what it needs, and you can see where it wants you to spend a little love and attention, it's a great way to bring that back around to good health.
Yeah.
I love it. So,
Yeah.
Leslie, how do people find a thermographer? How do they look for a good thermographer?
I'd like to say I'm a good thermographer. But seriously, if you have like friends or family, in other areas around here that's not close to Knoxville, other states, I would say honestly, the easiest thing is just reach out and ask me because I would know where all the other doctors are. I can go in and do looking for those things. You
Great.
can Google it. Where is thermography in Texas? Something like that. I can help you with that.
Okay, so if you want to contact Leslie, I'll have her give us your contact information, but make sure you let her know that you saw this interview so she knows that, hey, oh, this is because Sue and I talked, right? It's always good
Yeah.
for her to see where people are reaching her from. So Leslie, how do people find you?
The way that people find me mostly is people that have done it for the first time and love it. So they share that information to friends and family. Also, people that are just really tired of mammograms, mostly, they might start looking around for other things. And that's just basically, and also social media. I have a lot of people that follow me on social media and they'll send me a message. You can get my phone number, my email address, all
Okay,
of those things to educate and talk about how it works.
so how do they find you on social media? What's your handle?
Well, it's just Knoxville Thermography.
Oh,
Just
it's
Google
easy.
Knoxville Thermography and it'll pop up.
And
Yeah.
are you Leslie at knoxvillethermography.com?
Yes.
Yes, okay, Leslie, great. So Leslie,
No,
L-E,
wait. For my email,
yep, for your email.
no, it's just knoxvillethermography.com.
All right, at gmail.com.
Gmail.com.
Oh, there you go. How easy is that?
Yeah, so we wanted to keep everything easy because already thermography is a strange word for a lot of us anyway, something we don't talk about all the time. So I just want it to be very simple so that it makes it easier.
Nice. So final words, what would you like to say about what you do, why people should do it?
Well, for me, I think it's the happiness of it. I feel good about what I'm doing. I believe in what I'm doing. All of the clients that I see me, they believe in it. But the first time you do it, you're like, I'm curious, but I don't really know. And is it something true? But it's true. It is. And it's remarkable the way they talk about what they found in the body, options to talk from doctor to doctor, health provider to health provider. We have all of that in place. And I think that's really good too.
I love that. Well, I can't thank you enough for coming on with me today, sharing the experience. Like I said, I love the experience. I thought it was really interesting. I love to try new technology. I love to share it with everybody else. And I'm really hoping that this interview will actually encourage other people to explore this and find out more about their body. And again, you can go in and just do a breast, or I opted to do the full body. I highly recommend you do the full body because you can see they saw all kinds of things throughout my entire body that now give me direction so I can go find the tools to support the areas that said, hey, I need a little help here, kind of take a look at me, which is just great. All right.
Yes.
Well, thank you so much, Leslie. I really appreciate it. And we hope to maybe have another interview soon and maybe dig a little deeper.
Yeah, that sounds good. And I appreciate this so much.
All right, you're welcome.